Commissioner, there are some cuts in the budget, understandable, and I understand the direction that we have to go to make those attempts to cure the structural deficit that currently exists. But there are some programs that appear to be very helpful in accomplishing traditional goals that we all share, such as affordability, transparency, protecting our children. Who decided what particular line items were going to get cut in this year's budget, and what was the process that you utilized to accomplish that review?
It's my understanding that when I look at the programs that were cut out of DCF budget in the governor's proposed 27 budget were primarily programs that had been legislative add-ins. So they weren't part of the Governor Murphy's 26 budget. They were not part of our standard budget, but that they were legislative add-ins. And so I will say that, you know, the front office, the governor's office, did ask the departments to each identify some programming that we thought we might be able to cut or live without, and ensuring that, you know, we were still meeting our core services. And none of the programs that DCF that I put forward were accepted. So we did think that maybe we could take deeper cuts, and the governor didn't think so. And so she didn't accept those cuts. But again, these are primarily things that were added by the legislature.
Oh, I appreciate you being so candid. So you actually recommended cuts that the governor rejected?
Yes, at the request of the governor's office, they, you know, asked each of the departments. And so there were a few that we put up that, you know, begrudgingly, because you never want to have to identify cuts in service. But the governor's office did not accept those, recognizing the value and the work of the department and, you know, what we've been providing and our providers have been offering for youth and families in the state.
Thank you, Commissioner. And, you know, your mission as a commissioner is certainly one which is noble, taking care of our children and families. And, you know, I'm not done with my questioning, but thank you. Thank you.
So
for
that
all
means
the
the
work.
zinger's coming next.
Yeah, there you go. Commissioner, I'd like to turn your attention to Hazel Health.
Mm-hmm.
Was that one of the programs under consideration for being cut in the upcoming budget? And what can you tell us about the efficacy of Hazel Health? Did it work? And was it a benefit to the children that participated?
Yeah, I think the Hazel Health, that was something that was new in, was added, a legislative add last year or in our current budget. And the department, our department staff had worked closely with the Hazel Health staff to identify, you know, the different program counties and schools that they would serve. I think within the responses to our questions from the legislature, you know, there's a whole detailed list of all of the services and the locations that they were provided. And, you know, I would say that I don't know enough personally about the quality of each individual clinician. Like, we didn't get into that level of depth with this provider, and it's, you know, a new provider for us, and it's telehealth primarily. But I would say that, you know, anytime a young person has the opportunity to benefit from a clinical support, you know, I would expect that there's a benefit to them and their family.
And what is going to replace Hazel Health as we move forward into the next budget calendar year?
I think that, I don't know what will replace them directly, but the governor's certain interest and, has been very clear that youth mental health and ensuring that students get the supports and services, the mental health supports and services that they need in the schools, through the NJ Spark program and her interest in ensuring that there are more clinical services delivered in schools. I would imagine that that will pick up a component of that, along with there are, any number of clinicians, although always a shortage of clinicians, it seems like, everywhere these days, but a number of other providers, and whether that's through private insurance that people can access, through Medicaid they can access, families, or something provided directly in their schools. I do believe that there are services that would be available to those young people and their families.
And the concern that I'm certain that you share, Commissioner, is that we not have any child have their treatment suddenly drop off, because that could have significant and severe consequence. Would you agree?
Yeah, I don't think that we like to see, anyone, whether it's a young person or an adult who's in treatment, and then all of a sudden it gets, cut off quickly. I think there, could be a negative to that. And so I think, we'll be working to ensure and try and make the connection. I think the other thing I would say to that, though, is telehealth is not necessarily the preferred method of treatment for children and for young, and so being able to engage a child over the internet or the computer is very different than engaging them face-to-face in person, whether that's, in school, whether that's someplace in their community. And so while I think there's a lot of benefit to telehealth, I think we have to be careful about how much of that we use and for what population of child. And so I think the governor's agenda of really trying to look at providing more support and resources directly in the schools to do more school-based and more face-to-face and have more connections is definitely the direction that I think we should be going.
Something like the school-based youth
Like
services.
we already have school-based, yes. And so if there's a way of being able to build on that or expand on that, which I think is what the governor is looking to do through Spark.
Thank you, Commissioner. Commissioner, as you prepare for departure, is there any one project or one compelling idea that you didn't get a chance to implement that you would really like to see brought to fruition by your successor?
I have about a list of 100 things that I feel like I didn't get done and I wish I would have had more time or more opportunity to do. And of course, I will pass that along to my predecessor, my successor. And certainly the team of folks with me who will be here know a lot of what that is. But since you're giving me the opportunity to say something, I will say it's, continuing to do more for youth transitioning out of foster care, for older youth that, may be already struggling without having parents. And, any of us know how difficult it was at 18 or 21 or 25 or 30 to be able to afford your own housing and go to school and have an education and to be able to live a meaningful and productive life. It's much harder for children in foster care who age out without parents. And so I would just, I think there's more we could be doing. I would encourage this body, and I will be talking to my successor about what else we can do to be able to continue to support youth aging out of foster care.
Thank you for that,
Thank you for the
Commissioner.
opportunity.
I wish you all the best. Thank you.